Hello and welcome to the Eighth Note Sessions. I'm Mike Shamil.
And I'm Devin Mullen.
And our guest today is Sarah Grubbs, a social worker working in our community. Sarah, how are you doing today?
I'm doing good. How are you?
Good. Thank you for coming on the show.
Yes, thank you.
In the last few years, the pandemic has hit all of us, but it's also really had a big impact on the most vulnerable members of our community. How has social work tried to sort of ease that impact in the last couple of years?
Yeah, so it's definitely been a lot for everyone, no matter what age, whatever situation you're in right now. But I think as social workers, we've just been trying to be there more for our clients, even more than we are. I know for a lot of us, we started out using telehealth because we were on lockdown. We were able to access people in person or in the community. So I know from hearing from colleagues and then, other social workers in the community as well, that was a new challenge for them. Having to do this very hands-on work, one-on-one work with individuals through phones, through laptops. So I think just more than ever, we've been more understanding if people have to cancel, if maybe they're not feeling it one day. Just having to be aware of how this can be a lot of added stress for them, in addition to everything else that they already have to navigate in life.
Yeah, I imagine that, in addition to all the difficulties folks were already facing before, once now you have to, add in the dependency to scramble together and get enough technology in order to continue on with things like this. I know a lot of musicians, including myself, when lockdown began, we really were like, okay, do we have enough computers and webcams to continue performing? But those tools also become really important for, education and, telehealth, sessions with your doctors and social workers and, other professionals. And I imagine suddenly having to implement all that and scrape all those resources together, must have been a challenge. Did you find yourself having to reach out to the community to find some of those resources to help your clients be able to interact with you over the internet?
So I guess for me, I was in a situation where a lot of my clients, whether it's they themselves have their own phones or tablets, I know for a lot of the schools in the Buffalo area, they were giving them Chromebooks to use at home. So I think I had some clients that were utilizing those Chromebooks or those computers from their schools. But for the most part, I really didn't see, at least on my caseload that I serve, too much of an issue because they could use mom's phone or they could use their school's computer that they had been given. I'm sure
awesome.
Maybe for others it might have been hard, but yeah.
It's cool that people found ways to sort of all right, we've got this one thing, we can make it work for all these.
Yeah, exactly. And that's kind of the response from my agency. It's going to be 3 years this week is the anniversary. I remember.
Scary enough.
Yeah, it's crazy. They were just saying that, on the TV or the news earlier. But I remember my agency, my supervisor called us the first day of the lockdown, and this is what we're going to do. This is what we tell clients, and their response was pretty helpful, pretty fast. So we were able to get approved for a telehealth website pretty quick.
Wow.
And just turn over our sessions to video. So I was pretty blessed. I don't know for other agencies, how well they were able to kind of organize that. But yeah.
I mean, something you spoke about earlier was the sort of latent challenges that existed in the field, even prior to the pandemic. You referenced things sort of exacerbated by that, like career burnout. People who I think just are taking on too much work, and it's, sometimes enough's enough. You've also had a really wide base of clientele that you've worked with, folks who are in the rural, suburban, and the urban, and all different along racial and socioeconomic lines. What are some observations you've made about difficulties in communities having such a wide survey?
Yeah, I think I would say, for example, I've had a couple clients that have needed assistance from the police. And I know, like, there was one time I was at the house with the client and her mother. And yeah, we had called crisis services. We had called the police to help us out. Luckily, things were resolved. But we were waiting for the police for about, I think it was like 2.5 hours to get a response.
Wow.
And I've heard of some people who have had that same experience. So yeah, I was a bit having to go through it, or like, see it happen right before my eyes. I was a bit shocked, because if that's happening to that family and that person, then it's got to be happening to many others.
Right. That's just what you've seen in that moment. And you do not have a light workload either. You said you, in a given month, will see about 40 people. And,
yeah.
And these aren't in-office visits either. I mean, this is either telemedicine or home visits.
Mm-hmm.
I was wondering, because that's interesting. I think, there's kind of blurred lines between what's a psychiatrist, what's a psychologist, what's a social worker, what's a counselor. Just to clear it up and educate me, at least. Well, what are the specificities of being a social worker? What does it mean?
Yeah. Another good question, because when I was going through, I had said earlier, I had been a psychology major, and I was thinking that I was going to be a psychologist. And it was very, I guess, concrete in my mind. I would, see clients. They would come into my office. We'd have sessions. But with social work, I guess the difference, because you have therapists, you have social workers, you have psychologists, you have psychiatrists. So for social work, I think it's very unique because, so there's MSWs, Master of Social Work. There's BSWs, Bachelor of Social Work. Those are more of entry-level jobs into the field. So like case managers, there's also like health home care managers, who are kind of like the same thing. They're just working with one family or one client, and they're kind of navigating all the services that they have put into place. I'm at the master's level. So I'm providing some counseling services, like I said earlier, skill building, things like that. And then there's also, I won't, because I get the terminology mixed up, but there's clinical social workers, and they have to be licensed as well by the state. So they have to have a certain amount of clinical hours, and they're able to open up their own practices. So like one of my professors, she has her license. She's a clinical social worker. That's her title. So she has her own practice that she has her own clientele. There's also social workers in the military. There's social workers, there's school social workers. You have to have your own like certificate to be in the school. There's medical social workers. So I guess that's partly why it drew me more in, because there was such a variety of what you could do and who you could work with as well.
It sounds like until you get to the level where you're getting certified, it's fairly generalized. In our pre-interview conversation, we talked about the demographics you work with, and at an abstract, it's individuals with behavioral learning and cognitive challenges. I imagine that's very challenging, because working with someone who is autistic is very different than working with someone who suffers from schizophrenia, who suffers from borderline personality, or pick your name. Mm-hmm. You can't use these labels as a rule book in how to interact, right? Because they're not deterministic things. So how do you generally approach these situations where you're dealing with someone who's neurodivergent, and how do you find the common ground to communicate on and communicate effectively?
Yeah, so I know even in a lot of my social work classes in school, we would get to learn about each diagnosis. They have different symptoms. It shows up differently in other people or individuals. But I know a lot of my professors, they had us taking more of a scope of where we kind of meet the client where they're at. That was like a very common quote that they would use with us, because we go in. Before we go in, we have a referral. It says, they need this service. They have presenting problems such as trauma, anxiety, social anxiety, conflict at home or outbursts, anything along the lines of that. So, but even though there's a referral, or we see documentation from a doctor or previous clinicians, notes, things like that, they always want us going in kind of fresh mind and asking them almost like we're meeting we are meeting someone for the first time, but almost like you're meeting someone for the first time and you're not necessarily going based off, I see that you have anxiety and bipolar disease.
Yeah, you're not just going through the clipboard and judging off that, right?
Exactly. We have this framework where we know that environmental things can impact them, biological. We take in all of those factors.
In this way, it sounds, and I'm sure, you have association with the more clinical side of things. Like, if there's referrals, there's, I assume, talk happening between, the psychiatrist and the social worker if the case needs be. But it sounds like social work in this way is a lot more collaborative than prescriptive.
Oh, yeah.
Which is interesting. You also talked about skill building, which I think is a wonderful thing. I just want to give my compliments to the line of work you do. My youngest brother is autistic, and I know his folks who work with him have made a very large impact on his life.
Yeah.
Okay, so what we're looking at here is we have a medical system which is buckling under its stressors, society rife with inequity, global pandemic, and pick whatever social ills you want to throw into that soup. How do you compartmentalize your anxiety from this work?
because it really isn't just like one thing. It's, you know, it's a pandemic. It's bullying. It's social anxiety. It's you know, having broken relationships with the people that are within the home. So, and yeah, of course, the anxiety part, because we work so close with the client and their families, you develop a pretty personal relationship with them. Sometimes I feel like I'm like part of the families. That's how some families like treat me. So, you know, when you hear of all of these things that are happening, or even if you just, because I do this a lot, like I get anxiety over just watching the news and what's happening. You know, it's hard to be able to separate that and not let it consume you, not let it follow you. So I think a lot of it, what I've been finding too, is just reaching out to my support systems, just as how I would have my own clients reach out to their support systems. So whether that's a teacher, a school counselor, someone within the home. I use supervision a lot to kind of dump everything that, you know, I'm experiencing during the week, because it's not good to keep it in, and that's a bad habit of mine. So I definitely have found that, you know, reaching out.
It's an interesting comparison, because the individuals you work with, I mean, at root, a lot of the difficulty probably comes from a state of relative invisibility in society, not being seen for their truth selves, and not being able to express themselves in a way that's easily understood. And in turn, the way to deal with that sort of transference of suffering is to make your own struggle visible within your community and share in that. So I like that unity of it. This is a music podcast, so I do feel required to ask. Does music have any intersection or play a role in the work you do?
Yeah, so one of the things that we want to help clients develop is a sense of being able to manage their own behaviors. We know that anxiety is always going to be there. You know, their diagnosis isn't just going to go away, but we want to instill tools and hope in them that, you know, one day they don't need us, and they're going to be able to manage these things on their own. So when we talk about coping skills, you know, these are just simple everyday things that they can do, you know, if they're in crisis, or if they're needing help at that moment. So I know a lot of my kids and teens too, like they listen to music. They know that as something that is, you know, really helpful for them. Like I have one client who, she's always listening to music when she's with me. She has her headphones on. So, you know, I can see how for some clients in particular, like that is something that music is something that they can always go to. And I think for a lot of us too, I know for myself, like music is just always something that is there. Like with our phones, we can download songs. We have Spotify, you know, I use YouTube on my TV, and I'll, you know, play some music there. I feel like music for, you know, the general population has just always been something that's there and accessible that everybody can like relate to.
I mean, that was sort of I know where we met. Megan Jones, her single release party at Bridge Studios. You know, it's where all roads meet.
Yeah.
I think that's about it for my questions. I got one more, and then I'm gonna hand it off to Mike to finish up. So your work deals directly, I think, with, in some way, the consequences of our society. You know, people are sort of placed in the positions they find themselves in, and there's, you know, biological impetus. You know, you can't. There's no controlling force on what makes someone neuroatypical or suffer from a behavioral illness, but the lack of services, the lack of visibility, the lack of community, we collectively bear responsibility for that. It's not fair to put it merely on social workers and the clinical staff who are working around the clock to make up for that. So to that end, what can, you know, regular average people do in the day-to-day just to make this place more welcoming and survivable for the people you work with, and maybe everyone else also?
Yeah, I think just knowing that, you know, you can have a diagnosis of mental health, whatever it may be, ADHD, anxiety, depression, disorder. But, you know, if you're someone who doesn't have a diagnosis, you can also kind of have those similar experiences. I mean, I talk with a lot of my clients who, you know, they have diagnosis that I don't have, but we can kind of connect on, like, oh yeah, you had, because a lot of my kids are school age. They talk about like having anxiety, and, you know, taking tests in school. And, you know, I'm like, oh, well, yeah, I hear you, because I went through that myself. And now that I'm adult and I think more about it, I was like thinking, yeah, I probably could have gotten a little bit more help, and it would have been helpful to put like a label on it. Because sometimes labels are kind of, they can be helpful for people in order to different services or resources.
They're a starting point. You can start at the label.
Starting point. Yeah, definitely. So, you know, they, and I don't like to say they, we all have like a collective, we all have collective experiences, and just knowing that there's really not that much of a difference. Yeah, it may say on paper that they have this, but a lot of the things that they experience on a daily basis might be something that you might have experienced like last year or last week. So, and just being able to hear them out and what they perceive, or, you know, what is their reality. At the end of the day, it is their reality. So they should be able to, you know, have that, like, be able to express that.
Beautiful. In short, take a minute to listen and take a minute to understand.
That makes a lot of sense. To pivot a little bit, you know, I see that you know, social work is one of the many pieces in a community to help, you know, heal a community. A lot of artists, you know, there's the trope of being the struggling artist, the struggling musician, but even though it's a trope, it is sort of a really common thing. You know, it happens to a lot of folks that are trying to make music as a living, and maybe going through a lot. What kind of resources are there out there in the community that they could tap into, not just in a moment of crisis, but just in general?
Yeah, I would say, actually, so this comes to mind. So I don't know if you are aware, but it's called 211 Western New York. So it's actually, I don't know how to explain it. It's kind of like a hub for different services and resources. So I know they have a website, and then they also have a phone number, and it's really easy. And I've used it with clients right in session. So if you're looking for support groups, or if you're looking for other kids that have or that are on the spectrum and that have autism, you can just type that in and it'll give you a resource. You can even, it goes by your zip code, your town, your city. So I know that's one out there. Just because I was there with a client earlier, the library, I've seen them have pamphlets for 211 in different associations, like the Mental Health Association of Western New York. So yeah, just like small community spaces, like the library. There's a lot of resources there as well.
That's awesome. I didn't know about 211, and I feel silly because that's such an easy number to remember. I know about like 511 and 911. You know, I feel like I should have come across that and at least taken mental note of that. But that's a wonderful resource to know exists.
Yeah. Don't feel silly because I actually just found about it recently, within the recent months. So, and from what I know, it's also in different states. But yeah.
Well, I'm glad that you brought that up because I'm hoping that, you know, at the end of the day, when people watch this show, there's a few nuggets of value that they find, and I hope that's one of them there. Also, on the same note of community, you've seen a lot of different folks in a lot of different situations, and I wonder what kind of commonalities you've sort of come across. What kind of things can the community be doing to support each other without even having to know some of the specifics of what their neighbors are going through? What ways can we be more supportive of each other in Western New York?
You guys are asking very good questions here. And I'm not sure if I have all the best answers, but I guess it kind of goes back to just knowing that behind a door, or, you know, even behind like a happy face, there's a lot that's going on. There's a lot that goes on with individuals, families on a daily basis. So I feel like it kind of sounds redundant or cliche, but just being able to like understand that you know, what is going on in our household is probably not that much different than another household, and hoping that we can not be so isolated, like within our own like personal lives. So yeah, and I think it just goes back to wanting to listen, but also wanting to understand as well. Because I think we can listen. Active listening is a term that we actually use a lot in social work. It's where we're hearing the person, but it's with purpose, and we're trying to understand their situation, where they're coming from. So, yeah, I guess I would kind of leave it at that. But
well, thank you for that. I think that's a good place to kind of, you know, wrap things up. Are there any other resources that you want people to be aware of before we, you know, wrap up the show here?
So there is Crisis Services of Western New York. They have, and it's a simple Google search. They have a 24/7 line, and you know, it's very simple. You just call, you kind of explain what the situation might be. It could even just be wanting someone to hear you out. So they'll kind of take your case, they'll evaluate it. And if it's a situation where it needs care, or, you know, more care to it, they'll have a mobile team that comes out right from where you're calling. And to help kind of further assist you.
That's awesome. Well, Devin, did you have any last final thoughts?
I guess to tie because this has been a basic theme. A lot of times when people are speaking and sharing their story, we're always in a rush to form our next thought or our response. And when we do that, we deny ourselves the possibility of understanding. So sometimes it's less difficult if you have an empty head and you just let statements be. So again, take a second, listen, and understand. And that's it for me.
All right. Well, thank you, Sarah, so much for coming on the episode.
Yes, thank you guys.
We appreciate it a ton. This has been the Eighth Note Sessions. I'm Mike Shamil.
And I'm Devin Mullen.
And our guest today was Sarah Grubbs. Thank you so much, Sarah.
Yes, thank you guys.
Now I've got